And we are going to go over some of the steps that you have taken to reverse your weight gain, which is what we call obesity, and then also how we have identified for the first time that you have coronary artery disease and you have coronary artery disease by the primary thing which is called advanced cardiac panel, which is not usually done by your doctors. I know you both have Kaiser insurance, but even in private practice, doctors usually do not do advanced cardiac panel because the standard of care in this country is dictated by the insurance industry and is not based on the cutting edge discovery of medical science. So what we have done in this clinic for you is we have done this advanced lab test. Let me point out the key finding that made us to discover that you have coronary artery disease. Now, in case of Rick, we looked at your advanced panel. LDL particle number is 1171. We want it to be below 700. Secondly, what is more important is in Rick's case is the HSCRP. It is the marker of inflammation in your blood vessel is elevated. That tells me that there is the inflammation in your blood vessel, and that has led to coronary artery disease. And the same thing, because the inflammation marker is high, you are on a time bomb, meaning thereby the plaque can rupture anytime. So based on that, then we looked at the further detail, the anti-inflammatory component, the fish oil equivalent of omega-3 in your cells is low. It should be more than 8, you're 6.9, even though you were a fish eater. Right? Based on that, we did additional testing as well, and to look at your insulin resistance. We looked at your beta cell function, insulin resistance, and glycemic control, and which is part of your weight gain and obesity. Those markers are telling me that you do have inflammation risk by insulin resistance. So with this picture, Rick, is it what I sent you for a heart scan, right?
You did.
What did the heart scan tell us?
It confirmed that I had coronary heart disease.
How many arteries were involved?
I'm not sure.
I think you had 2 arteries, LAD, the left anterior descending, and I think right circumflex, both were involved.
I know one was really extremely involved. No,
Yes.
I think it was the right one. And the
Right
left one,
one.
and the left one wasn't as bad.
Not that, you're right. And we will look at the details of it.
Yeah.
But so, based on that, we confirmed that you have coronary artery disease.
Correct.
It is as definite as saying you're pregnant or not pregnant, you have coronary artery disease.
Correct.
Now the next step is, if you have it, what do we do next? Then we start reversing your coronary artery disease, and which is like, usually I say, when you go and grab an egg from the refrigerator, if the egg broke, you do not try to reconstruct the egg. You go after the forces that broke the egg in the first place. So similarly, we found out you have coronary artery disease. Now we are working on how we can reverse it.
Yes.
And that's what we did. So what all things did we do to reverse
Well,
your
the first thing
coronary?
I'm doing is trying to get my weight down.
Yes,
And you put me on a diet that put me in kind of a keto stage.
yes,
Recommended fish oil,
right,
which is a very important part. And
Right.
I have basically maxed out the largest pills I could find right now, which is 2,000 something per pill milligrams. Started mild exercise because I'm working a lot, and I'm going to go on a full exercise program.
right.
And then, whatever other advice you're going to give us.
And you have gone on a
Greens.
ketogenic diet,
Yes.
which is very simple. Can you explain the diet that you did?
Well, it initially starts with an avocado in the morning with
Right.
the XCT oil, and then we are allowed to eat whatever greens
Right.
heavy dose of greens, and so we'll have salads for lunch or dinner with vegetables with olive oil, which is a key ingredient we use.
Right.
California olive oil.
Right.
Lots of water. It's 80 to 100 ounces of water a day.
Right.
And we're just still growing. We're still at our infant stage.
And how about dinner?
So
What do you
we're
eat
still
for
learning.
dinner?
Dinner is usually a vegetable of some sort, either asparagus,
Right.
green beans, or Brussels sprouts that are cooked in olive oil and garlic.
Excellent. And you were not vegetarian or vegan before,
Oh no!
and now you are.
Well, we're working on it. I wish I could say I could.
Most of the times.
We're
Most of-
trying.
In other words, out of 21 meals in a week, considering 3 meals per day, how many meals do you eat meat right now?
None.
None. That's the answer. Okay. Now, question to you. Now, you have been in our program for how many? 3 months?
3
now?
months.
How many pounds have you lost?
34 pounds.
34 pounds of weight loss without taking any medication. He is not taking any weight loss pill. He is only on this partial ketogenic diet, not complete.
Correct.
Which means after you have eaten your dinner, in the morning instead of breakfast, you have the avocado and XCT oil, which is a brand of MCT oil.
Correct.
Okay? If I may explain to you what the XCT oil does, XCT or MCT oil is, there are 3 things in there in a coconut oil. C8 or caprylic acid, C10 or capric acid, and the C12 or lauric acid. The MCT oil you are taking has a C8 and 10. And this one triggers ketosis in a very healthy way.
Nice.
You see? And along with the avocado. Avocado is a good fat, and then the XCT oil, MCT oil, triggers so that you are consuming calories from your own stored fat as opposed to the fat given from outside.
It's amazing.
And this happens because you're not taking any carbohydrate or protein with your breakfast.
That's true.
Do you drink coffee or tea?
Coffee.
And you do that in the morning.
Correct.
And is it with sugar, without sugar?
It's no sugar.
Right.
It's a liquid additive syrup.
Liquid syrup. It's
Okay. What is it? What is that, sir?
tahini or not tahini. It's this is the brand name. I can't remember the brand name of it. Anyway, it's
It's a non-sugar.
coconut flavored syrup with and it's 0 calories. So it has
Okay.
Doesn't
Okay.
have sugar in it.
That's fine. And it might even have some coconut-like MCT component in it. I don't know,
Oh, look.
but you can look anyway.
Yes.
So what other test did we do?
Those were the 2 main tests, but in addition, what you recommended was for us to increase
Yeah.
the statin from 20 milligrams to 40, which our doctors confirmed and have done,
Right.
and then to add CoQ10, which we just purchased this last week.
Perfect. And then statin, you were on atorvastatin or rosuvastatin? Which one?
It was a Ristogastin.
Yeah, atorvastatin.
Okay.
Yeah, atorvastatin. It's called Lipitor.
Yes, it
So
was.
we increased it to twice the amount
Correct.
because your LDL particle number was high in spite of taking the statin.
Yes.
This is what is called residual risk due to cholesterol. And in our clinic, what we explain is the LDL particle number has to drop below 700 to protect his heart, and that is and it is called residual cholesterol risk. The second component is the residual inflammatory risk because his HSCRP is high in spite of taking the statin.
Yeah, and the timing I was taking was incorrect. I was taking it in the morning when you directed me to take it at night so it has a better saturation rate.
That's correct. Because atorvastatin should be taken more at night because the cholesterol synthesis occurs at night. Rosuvastatin can be taken any time of the day. Okay. So here is what we have done for you different than what is usually done in our community. Number 1, we made you lose weight 30 plus pounds. How many pounds?
34.
34 pounds in 3 months, which is substantial. Then we corrected your cholesterol residual risk by increasing the statin level. Third, we made you to lose weight. When you lose weight by the method of a ketogenic diet we talked about, you are losing primarily your visceral fat, which is the most toxic. That is the uniqueness. Visceral fat is the fat in your belly, inside of your belly, not you pinch in your love handle. That's not visceral fat. Visceral fat is inside. That is toxic fat.
Yes.
That causes heart disease. That causes stroke. That causes cancer because it is toxic. It releases inflammatory mediators and cytokines. Okay, so that is what we have done. Now let's switch to Donna. Okay, when we first saw you, we found that your LDL particle number is 1,363, which is very high for you. Plus, you had additional risk of LP little a. LP little a is if I can classify the cholesterol as a good cholesterol, bad cholesterol, ugly cholesterol, and deadly cholesterol. Good cholesterol is HDL. Bad cholesterol is LDL. And then ugly cholesterol is triglyceride. Deadly cholesterol is LP little a. That's what you have.
Okay.
Now, based on the fact that she has very high deadly cholesterol LP little a and particle number is high, based on those two factors and her HSCRP is sky high, 43, normally less than 1. And myeloperoxidase, which is second marker, is 265, normal should be less than 255, and her homocysteine is 12. With these three markers, I was really concerned that you could have an impending near-term coronary event. Just like telling a near-term pregnancy baby can come out anytime. Near-term coronary artery disease, you could have a cardiac event like heart attack, stroke, or death. These are called major cardiovascular event. I was concerned that you would have it, and for that reason, I sent you for a heart scan. And what did the heart scan show?
That I had the disease.
You had a multivessel coronary
Yes.
artery disease.
Correct.
You had a LAD and also the right circumflex.
I think I just had one.
You had only one.
Yeah, I
You're
only
right.
had
He had both too.
Yeah, both.
But that was substantial.
Yes, yeah.
Okay. Now, I sent you to Stanford Radiology to get your heart scan done.
Correct.
And they charged you how much?
$100.
150.
150.
Yeah.
Heart scan used to cost up to $500.
Yeah.
Due to a consortium called RCI, Right Care Initiative, a consortium between UC Berkeley and UCLA, and we are able to make heart scan available for $150 at 3 centers in California: Sacramento, Davis area, San Francisco Bay Area, and Los Angeles area at a cost of $150.
That's great.
So that people like you can go and get it tested.
Yes.
No insurance covers heart scan except in the state of Texas, where it is a law that it should be paid by every insurance.
Wow.
In the state of California, it does not pay. So heart scan diagnosed that you have coronary artery disease. So first time, right?
Yes.
You never had, nobody ever told you
No,
that
not
you
even
have.
in my blood work at Kaiser did it show these rates.
They
So
didn't.
I wasn't even on a statin.
You were not,
At all. I
she
was
was
on
not
zero.
even on statin at all.
No.
And then her HSCRP, let me repeat, is 43.7.
Exactly.
Normal should be below 1.
So the normal blood test that I was getting at Kaiser was not showing these elevations at all.
That's correct. And for advanced cardiac panel,
Yeah.
diagnosed you for the first time. Okay.
Yes.
And then what happened?
Then I went on the I went to my doctor and showed her this panel, and she put me on a statin.
What kind of statin? What's the name of it?
Oral, whatever it was. Aristovastatin.
Atorvastatin.
Yeah.
Yeah, atorvastatin. Fine. Did she put you on CoQ10 as well?
Yes, she did.
Good. That's good. CoQ10 helps you to prevent the side effects of statin.
Yes.
Particularly, there is a slight side effect of statin on the cardiac muscle itself. Okay, we are treating statin for your artery, not for the heart. That's why our slogan is invest in your artery. Okay, you could have heart disease and you can buy a brand new heart and have a heart transplant.
Right.
But your arteries are still there in your body that can give you stroke. Okay, that is why, in this day and age, heart is not as important as your artery. It's a paradoxical, right?
Yeah, it's crazy.
You can rent somebody else's heart and live with it, right?
Right.
And
It doesn't do any good if you
doesn't
don't have
any-
good arteries.
That's correct. Like if you wreck your car, you can go and buy another car, but I want you to become a better driver. Yes? If you wreck your marriage, you can go find another spouse in the society.
Not as
But
good as
I
he
want
is.
you to be better to begin with.
I
Right?
agree.
So this is why, heart transplant has revolutionized our life. Right?
Yeah.
But still, that's why our focus is invest in your artery, treat your artery.
Yes.
Now, you started also 3 months ago. You are not on any weight loss medication, and you have lost how many pounds?
36 pounds.
36 pounds in 3
Beat
months.
me.
Huh? She beat you, only a couple of.
Just a couple of
Couple
pounds.
of them. And so couple of pounds, but 36 pounds in 3 months.
Yes.
And no appetite suppressant, no weight loss drug,
No.
just by diet. And I hope you're on a vegan diet?
Pretty much, yeah. I
Pretty
have not
much.
had any meat at all
No.
for
Yeah.
quite some time.
Right.
So,
Let me clarify. If given the freedom, do you enjoy eating steak?
Yeah.
Yeah. If given freedom, do you enjoy eating
do.
steak? Okay. Now, I give you, this is called steak, how to enjoy your steak and then still become a vegan. Ideal for your culture. I'm a vegan, by culture and heritage. But, you are steak eater, which is fine because your mother told you where is the beef. And then
Yes.
they trained you to eat the beef, right?
Right.
So, how can you, first of all, let me clarify, how does steak cause heart disease? Okay, very clear.
Yeah.
When you eat steak, the carnitine in steak and a little bit of, carnitine becomes TMAO, which becomes toxic and produces inflammation, increased C-reactive protein and coronary artery disease and even a heart attack. Cleveland Clinic research by Dr. Hazen, I'm sorry. There are two doctors there, Dr. Hazen, Hazen. Dr. Rosen is the other doctor, okay? He's in the preventive cardiology. So, how can you do it? My main thing is gut bacteria changes. So, when you become vegan for 3 weeks as a compulsory program to reprogram your gut bacteria, once we have reprogrammed your gut bacteria, 1 or 2 steak eating per week will not cause any damage. The same steak that was causing a heart attack or a cardiac risk is no longer would do it now because gut bacteria, primarily Bacteroides, Firmicutes and Akkermansia, changes favorably to protect you by the pathway of short chain fatty acid, which is butyric acid and acetic acid and propionic acid. These short chain fatty acids are changed by your vegan diet, and your gut is reprogrammed. Now you can eat your steak, and then the steak will not cause the damage that you used to do. You can still enjoy 1 or 2 steaks per week.
Well, now our beans that we're eating are like steak to us.
yes.
You see that? Yes.
It's a great substitute, I'll tell you.
Yes.
We love it.
Beans are the best food, by the way. Beans and lentils, because they produce that short chain fatty acid and healthy bacteria. It can be black bean is king of beans. You can have garbanzo bean, red bean, navy bean, lima bean, any beans. And lentils and both are your friends. They do increase your intestinal gas because you pay the price of gas.
Yes,
Yes.
we do.
Okay, in Europe, gas is called petrol. It petrols your life. Gas is good for you.
Yes.
Every human being should pass 20 to 22 times of passing gas per
Wow.
day.
Well, our son does very well then. Our Down syndrome boy, right,
That is
Rick?
good for him. He has healthy gut.
He does.
And then the gas will not kill you. Gas means you're building healthy bacteria, short chain fatty acids. These are all the benefits. So now, in summary, you both have come as a couple, so that your cooking, your kitchen at home is set to be vegan.
Yes.
I directed you to a website called Vegan Kickstart. And that website tells you it is put out by Dr. Neil Barnard, which is free for any one of us to use. So for people who are habitually meat eater in the Western culture, Vegan Kickstart is a software app online that you can use to restock your kitchen and to learn to be vegan, and if not for lifelong, at least for 3 weeks to reset your gut bacteria so that you are protected.
Nice.
And so our policy is continue to take your cholesterol medication, except remember this one very important fact. Cholesterol medication like atorvastatin only gives you 25% of protection from cardiac event. And that means 75% of the
Still
protection comes from reducing inflammation.
Okay.
And that reduction of inflammation is by things like fish oil, vegan diet, gut bacterial correction, insulin resistance correction. Sometimes we give metformin, and then also managing your emotion.
Well, and you're forgetting the wonderful probiotics we get.
Absolutely so. The prebiotic. These are
You're right, you're right.
prebiotics. The prebiotics you get is called 4-biotic, which has 4 items. Agave inulin, the resistant starch from potato, it is called potato starch, resistant starch from green banana, and then finally white bean powder. These 4 together go inside the gut and work on your short chain fatty acid and build the healthy bacteria. That is, when you have prebiotic, for probiotic, bacteria is not critical because it is just like giving fertilizer for the lawn seed. If you give fertilizer, the lawn seed will grow. If you don't give the fertilizer, the lawn seed will die. You have healthy bacteria in your gut, and all it needs is a prebiotic to make it faster. You see?
Right.
That's why you have healthy bacteria that is protecting you. The major pathway of protecting is anti-inflammatory effect. I would be very curious to repeat your blood test and see your HSCRP of 43.7 should reduce to very close to 1 now.
Wow.
And we will repeat it and prove it to you.
Well, we're like where we're at.
Yeah,
We're learning, obviously, along the way immensely.
Definitely.
right.
And we feel like if we could stay on it 3 more months,
Yeah,
which I'm sure we can and we want to,
And probably
that you were going to
more
see
for
a
me.
significant change in those
I expect. And
numbers.
at the rate you're doing, in 3 more months, you may lose another 30 pounds, each of you. Okay. That one substantially will help your happiness and health together. Okay. So the final note is I'm glad you came as a couple as opposed to one.
Yes.
Okay.
That's
So,
what we wanted to do.
that
We've not
is
ever
the-
done that before
right.
after almost 39 years of marriage. So we
That is
decided we
right.
wanted to do this
I am
together.
glad you did that.
I'm glad we found you.
Yes,
Thank you.
I agree
Thank
with
you.
that.
Thank you. And now I invite you, if we have a workshop coming on July 13th where we talk about how to reverse coronary artery disease without surgery, without angioplasty, by natural method of diet and lifestyle changes. You will learn more from experts in the field as well. So thank you
Nice.
for participating in the discussion.
Thank
Oh,
you.
thank you.
Thank you.